Welcome, everyone. Tonight we are excited to have Barbara Viens here to talk to us about managing arthritis on behalf of the U.S. Bone and Joint Initiative. Barbara is the Director of Strategic Service Lines at Lowell General Hospital. She received her Doctorate of Nursing Practice degree with a concentration in Healthcare Systems Leadership from Chamberlain University and is credentialed by the ANCC as a Nurse Executive Advanced Certification. She received her Bachelor of Science in Nursing from UMass Lowell and her Master's in Nursing from Chamberlain College. And she has close to 30 years of nursing experience, is certified as an orthopedic nurse. So thank you to Barbara for being here tonight. I just have a couple of Zoom housekeeping notes. First, we're recording this session, so you'll be able to find it again on YouTube. The library's YouTube, as well as hopefully they will broadcast it on Waycam, our local cable access station. I will be recording Barbara's video, my own possibly, and her slides, so don't worry about showing up on screen. And during the slide portion of the program, I recommend you switch your view to speaker view, so you'll see Barbara next to her slides. And we're going to hold our questions until the end of the presentation, which should be about 40 minutes. But if you are afraid you're going to forget your question, feel free to put it in the chat and we'll make sure to get to it at the end. So now that I've got that out of the way, I will hand it over to Barbara.
Thank you so very much, Courtney. I'm excited to be here tonight as I'm very passionate about bones and bone health. Welcome everyone to Experts in Arthritis. And I always want to start with saying that we're going to cover a lot of information tonight, but always seek the advice of your healthcare provider before initiating any changes in your lifestyle, your diet, exercise, supplement intake, or for a professional opinion for arthritis management. I'm actually going to read two case scenarios, and I want you to listen and I want to see if you can identify with either one of these women. Teresa sits on her couch feeling sorry for herself, unable to take her dog Ginger for a walk. Her joints are too swollen and painful to pick up the ball. She has rheumatoid arthritis, or RA, an inflammatory autoimmune disease. Her rheumatologist prescribed medication, but told her she must make lifestyle changes. She searched social media for others with RA. Instead of the misery she expected to see, she found herself liking post after post from those with RA who had overcome challenges. Inspired by her new friends, Teresa took her dog Ginger for a walk and posted a selfie with the dog. Physical activity helped her symptoms, including her emotions and general state of happiness. She and Ginger resumed daily walks, and she joined a weekly water aerobics class. Teresa was motivated to eat more whole grains and vegetables. Her friend Darius's weight loss lessened his pain and improved his mental health. He shared recipes for the Mediterranean diet. Teresa's new friends cautioned her about being fooled by ads for supplements promising a cure for RA and told her to check for scientific evidence and with her physician before trying supplements, especially because she was on medications. Teresa and her new friend Maria exchanged tips and brainstormed ideas on ways to make everyday tasks easier and ways to handle the challenges of rheumatoid arthritis. It felt good to catch up on neglected chores. Teresa actually became the leader of her RA health team and works with physicians and other healthcare specialists to get information and assistance she needs to take care of her RA. Although arthritis can potentially be disabling, there are effective ways to regain function and independence. And like Teresa, you can alter the plot of your own story. Now, the next story is about a woman named Roberta. Different type of arthritis. Roberta stared gloomily out the window, unable to tend her garden because kneeling to pull weeds is too painful. Both her knees hurt, but the pain in one knee is worse from damage playing tennis as a kid. As a hairdresser, years of standing have made matters worse. Damage from the injury and wear and tear of work caused osteoarthritis in her knee, also called OA. Her knee is so painful, she spends evenings lying on the couch with a snack and a book. That feels better, but the pain and stiffness keep getting worse. Weight gain over the years has put more strain on her knee. Roberta used to enjoy connecting with other gardeners on social media. Now, scrolling through their gorgeous photos makes her sad. Needing someone to understand her pain, Roberta searched social media for others with OA, and she found people who had overcome the challenges of OA as well. She realized social media friends were taking control of their OA. She decided she would too. She invested in a quality pair of shoes and took strolls around her garden, even taking selfies. Roberta subscribed to a blog with healthy recipes for people with OA. Her efforts to lose weight, helped by a healthier diet, a home exercise program, and more physical activity, lessened her pain and improved her emotional health. She relied on over-the-counter pain medications until Martin's update on pain relief through physical therapy, injections, and use of braces prompted her to learn about these pain management methods. Her social media friends cautioned her to check for scientific evidence and consult with her doctor before using supplements. When her knee pain made her think about giving up her job, she considered a total knee replacement. While discussing pros and cons with her physician and specialist, she continued to lose weight, eat better, and become stronger and more physically active. This would help ensure the best outcome if she did choose to go ahead with surgery. She is now the leader of her OA health team, working with her primary care physician and healthcare specialist to get information and assistance she needs to take care of her OA. Once again, although arthritis is common, you don't have to lose the ability to do what you love. Now, I read both of those because one talks about rheumatoid arthritis and the other one talks about osteoarthritis. And I'm wondering if anyone who's attending tonight is suffering from either one of those types of arthritis. There are 100 types of arthritis. And obviously, we're doing this virtually. If we were in person, I'd ask, what kind of arthritis do you have? I will tell you that osteoarthritis is the most common type. Each has different symptoms, but they're all considered arthritis because they involve the joints. So each type of arthritis has different symptoms, but they involve the joints. The symptoms can be treated to reduce their effect, but to date, there's no cure for arthritis. Approaches to treating symptoms involve self-management. So don't ever let anyone tell you that arthritis can be cured. It cannot. It can be managed, and it can be managed very, very well, but there is no cure. And arthritis is a chronic disease. And managing arthritis symptoms can help reduce or alleviate pain, stiffness, fatigue, and improve your quality of life. I like to share these statistics because then you don't feel so alone. By the year 2040, more than 78 million people are expected to be diagnosed with arthritis. Almost 2/3 of United States adults with arthritis are of working age, meaning between 18 and 64. Nearly 300,000 children in the United States, infants to teenagers, are affected by some form of arthritis. And arthritis is the leading cause of disability in this country, with an estimated cost of nearly $130 billion annually. And people always wonder, well, do more men or more women get arthritis? Well, it's not evenly distributed by gender. Among women, doctor-diagnosed arthritis is more common than among men. Now, look at this slide here. I mean, it's a pretty simple slide, but it says everything that it needs to say. If you look at that joint on the left, that's normal. You see the cartilage, you see that the joint has space, and you see that the synovial membrane, which is around the sides of the joint, it's thin. And cartilage is a firm tissue. You can see the cartilage is in there. It's all smooth. Cartilage is a firm tissue, softer and more flexible than bone, that pads and protects the ends of the long bones at the joints. So that cartilage is looking pretty fine. The synovium is sometimes referred to as a membrane, and it's a soft tissue lining the inner surface of the joint, except where it is lined with cartilage. This is where the synovial fluid is produced, and that lubricates the cartilage and the bones. If your joint looked like that, you would be running marathons. That you would be styling. Now, obviously, when you look at that middle joint, that's prime example of rheumatoid arthritis. The joint capsule is inflamed and the synovial membrane is inflamed, and there's destruction of the cartilage. And in the osteoarthritis, you can see those bones are rubbing together. So the cartilage is eroded, and which causes, when the bone rubs together, you get particles and bone spurs. Have any of you ever had a little bone spur form in your knee? And you go to bend your knee and something gets caught. Well, that's a bone spur. And they tend to move around, but very, very painful. I'm just going to give a brief overview because we talked that there are 100 types of arthritis. We already talked about rheumatoid arthritis, and that's an autoimmune disorder. And in this type of arthritis, the body's immune system attacks the lining of the joint capsule. And with rheumatoid arthritis, cartilage and bone within the joint can be destroyed. Rheumatoid arthritis can also affect organs and body systems. Symptoms of rheumatoid arthritis may include loss of appetite, fatigue, and a low-grade fever. Now, osteoarthritis, that tends to affect, you probably already know, the hips, the knees, the fingers. It affects where two joints meet, and it often causes pain and swelling. It doesn't affect any organs, though. And as I said, it is the most common arthritis disorder worldwide. And it's often referred to as a degenerative joint disorder because it just keeps getting a little bit worse and a little bit worse. And it can cause pain, stiffness, and swelling. We talked about, I mentioned how many children have arthritis, and in their type of arthritis is called juvenile arthritis. And it's the most common form of arthritis in children. And this is another immune disease, and the immune system attacks the body tissues, and it commonly causes joint pain, swelling, fever, and rash. Lupus is another type of arthritis, believe it or not, and it's a chronic autoimmune disease affecting the joints, kidneys, and other organs, blood, skin, and brain. And common symptoms include joint pain, rash, fatigue, and many other symptoms, actually, and it can be treated with lifestyle changes and medications. Spondyloarthritis involves both the joints and places where ligaments and tendons attach to the bone. In most cases, it affects the spine, and some forms can also attack the hands, the feet, arms, and legs. And the first symptom can be low back pain. Gout is an inflammatory form of arthritis that may appear in the big toe. That gets affected most. And then also the ankle, the knee, and it develops in people with a high level of uric acid in the blood. And then the last one I'm going to bring up is psoriatic arthritis. 30% of people who have the skin condition called psoriasis will develop psoriatic arthritis. And the symptoms of psoriatic arthritis include joint pain and stiffness, fatigue, skin rashes, and swelling in fingers and feet. And the one thing that is not arthritis that I want to bring up tonight is osteoporosis, because that sounds like it should be arthritis because of the osteo in bone. But osteoporosis is a disease of the bone, not the joint, and therefore it's not arthritis. The word itself means porous bones, and it's a different disease in which your bones become weak and are more likely to break. Since I mentioned all those different forms of arthritis and some of the symptoms are fairly similar, it's pretty obvious that arthritis comes in different forms and affects people in different ways. It can be tricky to diagnose and requires a visit to the doctor, either your primary care physician or a rheumatologist, to be diagnosed properly. Symptoms that are common to all types of arthritis are joint stiffness, swelling, inflammation, redness, and decreased range of motion. Osteoarthritis is obviously caused by wear and tear, damage to cartilage, and when the damage causes bone-on-bone grinding, pain and restricted movement are the result. In rheumatoid arthritis, caused by the body's immune system attacking the membrane that surrounds the joint, it leads to inflammation and swelling. And this can also destroy cartilage and bone and lead to pain and restricted movement. And how many of you suffer from pain, stiffness, fatigue, and depressed mood? When you're in pain all the time, it is really tough to be real positive. And the next slide says, take control. What exactly does that mean? People with arthritis can take control of living with arthritis and help to manage some of the aspects themselves. And we call that self-management. And self-management is basically taking responsibility for making positive and healthy lifestyle choices to improve overall health and well-being. Acknowledging and addressing the physical and emotional mood effects of arthritis is another very important thing to do when you're living with arthritis. You also have to advocate for your needs as a person with arthritis by clearly communicating with your family, friends, and the medical community. Because if people don't have arthritis, they don't always understand what you're going through. You know, and sometimes it's easier for someone when they live with you because they kind of see what's going on. But if you don't articulate and communicate, you know, that you're feeling a little differently each day, people just don't understand that. And we also need to realize that every person's arthritis journey is different, and that you'll need to learn the best strategies for your situation. You know, and we need to learn and apply strategies to help you to feel more in control of your health, manage pain and other symptoms, to carry out your daily activities, such as going to work and spending time with loved ones and shopping or golfing. These are all very, very important things to someone's well-being. And also, if you're managing your arthritis better, it helps to reduce your stress. And we all could use that. I like this slide a lot because you, as the person with arthritis, get to be the team captain. You're in the center of our care, and your team involves your primary care physician, which is probably the person who diagnosed you to begin with. And the rheumatologist, you might have been sent to a rheumatologist because they're the expert in arthritis. And then there's nurses like myself, and we care for all different kinds of patients. And physical therapists help to improve movement. And occupational therapists do a very special job, and they help you to develop strategies to be able to do those activities of daily living. And a dietitian is a very important member of the team too, because we've all seen enough commercials to know we are what we eat, and a dietitian is an expert in nutrition and regulating our diets. Self-management, well, I mentioned that concept before. And self-management is the ability of a person with arthritis to deal with symptoms. It's as simple as that. And finding the best way to do it for you is very individual. As I mentioned, arthritis affects people very differently. And dealing with symptoms and the treatment and there's physical and social consequences and lifestyle changes sometimes that come about with arthritis. But with effective self-management, a person can monitor his or her condition and make cognitive, behavioral, and emotional changes to maintain a satisfactory quality of life. And some ways to take control of the disease include understanding the disease, because by learning more about arthritis symptoms, people with arthritis can make informed decisions about what strategies to use to better manage their symptoms and decide when to see a healthcare professional. And pain needs to be managed because pain wears you down physically and emotionally. And daily tasks can be daunting when you're uncomfortable and you feel betrayed by your own body. You need to talk to your primary care physician about ways to help you manage your pain and get further help if you need to, especially related to your emotional health. And being in control means coming to terms with your arthritis and moving forward. Things you can control include taking your medications as prescribed, dieting, exercising, and resting when you need to, as well as using assistive devices when necessary. And negative emotions can make symptoms of arthritis worse. Coming to terms and accepting that you have arthritis does not mean that you must give in or give up by any stretch of the imagination. Living with a chronic condition such as arthritis increases your chance of developing depression. Warning signs include constant fatigue, poor appetite, trouble making decisions, disrupted sleep, and feeling worthless or helpless. Develop a network of family and friends who raise your spirits and can help you keep active and seek help from your healthcare team. The next section of this presentation talks about the benefits of self-management. It talks about managing pain, some ideas for helping to improve mood and emotions, and about getting enough sleep and rest, being physically active, eating a healthy, balanced diet, carrying out your activities of daily living, whether it's dusting, going to work, or washing the dishes. And also, it's very, very, very important that you communicate effectively with your healthcare provider. And as we talk about these strategies, think about which one might work for you and which one you might like to try. Obviously, pain's a bummer. And taking control of pain is very, very important. About 1 in 4 adults with arthritis, that's 15 million people, report experiencing severe joint pain. And as a nurse and as healthcare professionals, we define severe pain on the pain scale. And you've probably been asked if you've ever been in the hospital, what's your pain score? And the pain score is from 0 to 10. 0 means you have no pain at all, and 10 is the very worst pain you could possibly imagine. And 7 is the number representing severe pain, and there's 15 million people with arthritis reporting that they have severe pain. Half of the adults with arthritis live with persistent pain. And persistent pain, the definition of that is that patients complain that they have pain just about every day for 3 months. We also refer to that as a chronic type of pain. To control pain, it's very important that you take the right type of medication at the right time and get the appropriate sleep, get the appropriate exercise, Practice relaxation techniques such as meditation, guided imagery, deep breathing. Also understand the emotions that can play a part in pain perception and control whatever trigger events. I mean, if running gives you pain, maybe you can't run. And there are some things that you don't have to do in life. There are other things that are pretty basic, but there are some things that maybe somebody else could do for you. And be kind to your joints and yourself. Eat well and make yourself comfortable. And sometimes you might need to use an assistive device. Self-help devices can make it easier for you on your joints and more efficient. These products can be simple or elaborate, and they can help keep your joints in the appropriate position for functioning, provide leverage when needed, and extend range of motion. And these devices include jar openers, reachers, easy grip utensils, and these can all be purchased at a hardware or a medical supply store. An occupational therapist, this is their specialty. They are rock stars at assessing you and figuring out what could help you perform independently your activities of daily living. And then, of course, there are orthotics, and those are splints, and they can help with activities at home and work. Contact a healthcare professional, such as an occupational therapist, to determine the best device. Splints and braces should never be self-prescribed. Foot pain is common with arthritis too, and 1 in 4 people will have problems with their feet. Orthotics are shoe inserts designed to help ease foot pain and correct structural issues, and they provide a lot of relief. And you can talk to a physical therapist to help you identify the appropriate proper support. And then, of course, there's heat and cold. When should you use heat and when should you use cold? Heat treatments such as heating pads or warm baths tend to work best for soothing stiff joints and tired muscles. Heat increases your circulation, delivering nutrients to the joints and the muscles. It's good for getting your body limber and ready for exercise or activity. Heat therapy may include hot packs, heating pads, warm baths or showers, whirlpool, or warm swimming pools. Moist heat therapy is good too, but the temperature should never be too hot, and you've got to be very, very careful not to get burnt. That temperature is the appropriate temperature to put on your skin. Cold is best for acute pain, meaning pain that just started today or yesterday, because cold helps to restrict blood vessels, and it slows the circulation and reduces swelling, and it also numbs nerve endings, which help to dull pain. And there are mind-body strategies for pain relief. Move your body. Walking, Tai Chi, yoga. Sometimes people think that movement is worse. Actually, staying still can be worse for your arthritis. If you get up and you move, and some of you, for instance, may already experience that. You're pretty stiff when you first get up in the morning, but once you get going, you're good. And I always say, with the yoga, strike a pose, breathe deeply, and meditate, use visualization, relax muscles, and get support from family and friends. I always ask people to picture the rooms in your house, and is there anything anywhere that is pretty simple to install or buy that would make your life easier? I'm a big fan of, in the bathroom, those faucet levers or the tap turners, and obviously grab tools in the shower. But absolutely reach out to your healthcare professional or physical therapist for ideas about how you can make your life a little bit easier in your very own home. And obviously, your emotional health is very, very, very important. And when you're not feeling well, you're more tired than usual, and you can be kind of angry and kind of sad about it. You can experience a range of emotions in response to living with arthritis: shock, relief, confusion, anger, frustration, anxiety, fear. Do you feel isolated because you can't go out? Depression, helplessness, sadness, shame, guilt, loss, and more. Emotional and physical health are linked. Each can affect the other, and arthritis is no exception. And different strategies may work for you. Some to try include some mind-body practices, such as meditation and breathing techniques, to decrease anxiety or alleviate stress. Enjoyable activities such as art or music can boost your spirits. Pampering and relaxation through activities such as massage. Make sure you pace your activities so you don't become overly fatigued, because if you become overly tired, that just makes everything worse. And basic self-care strategies such as getting enough sleep, eating healthy meals, and incorporating physical activity into your day. And if frustration and negative thoughts lead to isolation from others or no longer participating in events with family and friends, make an extra effort to seek support from this network or others. It's not good to let yourself get isolated. And if emotional problems or negative thoughts persist and are not helped by these types of strategies, consider seeking counsel or support from a mental health provider. You might need somebody to talk to that could really help you. And how do you cope with fatigue? It's a pretty key symptom of arthritis and a common reason why people with arthritis feel like they can't get anything done. Getting your energy back may be related to taking control of your arthritis. The main causes of fatigue include the inflammatory disease process and associated pain. You know, when you get inflamed, your body's immune system normally helps to keep you healthy. But if you have an autoimmune disease such as rheumatoid arthritis, your immune system attacks your body and everything swells up. The body undergoes stress as it tries to cope with the inflammation and the release of what they call inflammatory cytokines. And it's a protein in your blood. And they cause fatigue, especially when disease activity is high or you have a low-grade fever and the inflammation remains for a time. And this pain-fatigue connection can be a vicious cycle. Dealing with arthritis pain for months at a time over many years can wear you down physically and emotionally. It can affect your sleep, which adds to your exhaustion. Being fatigued in turn can worsen pain and make it more difficult to manage your arthritis. So pace yourself. Don't let that happen to you. Determine how much you can do and for how long. And take breaks before you get tired. And this might require a little experimenting. And you know what? Start small. So you do 5 minutes. And then you rest. You say, well, that worked out. You know, maybe I can do 10 minutes. And be self-aware. Keep a diary of what's working. And sometimes people think that's kind of silly, but it's actually very, very helpful to document it. And make time for activities that are really important to you and let go of those that don't mean so much. Give yourself permission to let them go. And make a plan rather than react to the symptoms. Think about how an activity will affect you and develop a plan to get through it without causing a flare-up. And pacing one day may not affect how you feel the next, but pacing consistently for several months may decrease your arthritis symptoms if you stick with it. And be realistic. Experiment to determine how much you can do on a good day and how much you can do on a bad day. Be kind to yourself and don't be too hard on yourself on those not too good days. And whatever you do, get enough sleep. And there are many benefits of being active. And as I mentioned a little bit earlier, many people think exercise will make their symptoms worse, when in fact it can help reduce the symptoms and make you feel better. People with arthritis can benefit from physical activity and exercise. And there are different types, obviously, of physical activity, and any active movement of the body is good for you, whether it's walking, dancing if you can, playing golf, swimming, biking, gardening, roller skating. Walk them all. You know, there's a lot of things that you can do that are pretty simple. And the current guidelines for adults 18 to 65, the recommendations for how much exercise that we should get is 30 minutes, 5 times a week of moderate intensity, or 20 minutes, 3 times a week of vigorous intensity aerobic activity. Now, it all depends on what you can do, but if you can walk for 30 minutes, that's pretty awesome. And you don't have to start at the 30 minutes. Walk for 5. And most people with arthritis pain will feel relief from activity. Doesn't seem to make sense because in your head you say it's going to hurt, but actually getting the blood circulating makes things less stiff and gets your blood circulating. And you can see there's different types of exercise. You can do flexibility training. You could do strength building and resistance, or endurance exercises. And the flexibility, sitting in a chair and raising your arms or knees. You could do those exercises every day. You don't even have to be able to walk to do that. And they should be gentle and not fatiguing. And strength building, you know, maybe you get in and out of a chair, or you lift light weights, 2 or 3 sets per week, maybe 5 times. And then endurance exercises are your walking, your swimming, your low impact aerobic activity, whatever works for you and you like. And before you start any exercise plan, make sure you check with your physician. We never want to make any changes without talking to your healthcare provider. And know your limits. You can go to a physical therapist for advice on exercises. And wherever you go, make sure the professionals have experience treating individuals with arthritis. And when you contact them, ask that question. And you could contact the physical or occupational therapy facility to see what services they provide. And how would you find a physical therapist or an occupational therapist? Talk with your doctor. You could talk to a family member, friend, referral from someone that they've seen and they like, or look online to find a facility. And we all know you can go online if you can attend a virtual class. So that is really it's a great tool in your tool belt. And what happens if your doctor hasn't discussed physical activity or exercise? By all means, you be proactive. You bring it up and you say, hey, what kind of physical activity could I do? And do you have any recommendation of where I can get some ideas and start? And food. Eating appropriate nutritional food every day gives us the fuel to do what we need to do. The foods we put in our bodies support our daily functions. And there's no special diet for arthritis. I'm going to say that right away. There's no special diet. But what you do eat affects your joints. And dietary changes may help eliminate the symptoms of arthritis. Following a diet low in processed foods, and eating more fruits and vegetables, grains, and more plant-based foods can help you stay healthy overall and address arthritis symptoms. Those processed foods, we all know that they're not necessarily good for us, and it doesn't mean that you can never have any of them, but you shouldn't make it the staple of your diet. And depending upon which medications you're taking, your appetite might be increased or suppressed. And for those with an increased appetite, some of you might be on steroids for your arthritis. Having quality snacks available, those high fiber, low calorie foods can help satisfy appetite without overeating. And for those of you that have a smaller appetite, some of you might be on some narcotics or immunosuppressive meds because they reduce your appetite. Liquid options such as smoothies with Greek yogurt, fruits, and vegetables can help you to get calories without making you feel too full. And you can't change what you eat, or it's hard to change what you eat overnight, but take incremental steps to change your diet rather than a complete overhaul all at once. Focus on small changes that are lasting and with foods that you like. And avoid overeating. Maybe share meals when you go out to eat or at home. And totally eliminating from a food from your diet that you really like is never recommended, because you're really going to crave that one. And when you get it, you're just going to eat as much of it as you possibly can. So limit it. Have that special dessert that you like at a special occasion, but not every day. And taking off weight obviously puts less weight and stress on your joints, and that could help you feel better. And your health and weight are connected. According to the Centers for Disease Control and Prevention, if your body mass index falls into the range of overweight or obese, you're at a higher risk for developing the following diseases and conditions, such as osteoarthritis, heart disease, type 2, diabetes, etc. And this doesn't mean you'll definitely get the disease, but you're more likely than someone who's in a normal weight range. And the key foods to reduce inflammation are also healthy foods and should be included in anyone's diet. And choosing a primarily plant-based diet can help with weight loss and weight maintenance. The Mediterranean diet has been shown to reduce symptoms, inflammation related to rheumatoid arthritis, as well as decrease uric acid levels, which is what we think causes gout. The foods to include are typical in the Mediterranean diet. And one thing to note is that this diet is lower in land animal meats. But before you change your diet, you need to talk to your healthcare provider, and they might need to send you to a dietitian, because the medications that you're on, you need to be careful what foods you are eating. Fruits and vegetables are very important. Fruits, fiber, whole grains, they help to lower pro-inflammatory biomarkers in the plasma. Now, what in the world does that mean? It's just if we drew a blood test, the markers that we measure to see how your rheumatoid arthritis is doing, for instance, the numbers are lower. Certain spices also may help to reduce inflammation. Turmeric and ginger. But as I said, before you start adding turmeric to your diet, check with your doctor. And going to McDonald's is probably not something that you should do every night. The French fries, the soda, these are all processed foods. And limiting them helps to reduce the fats and simple carbohydrates that promote inflammation. And this doesn't mean that you need to totally exclude them, but just to be mindful of how often you eat them and reduce sizes, portions, and our frequency. And one thing you really need to watch is the salt intake, particularly if you're on corticosteroids or you're taking steroids. As I said, a lot of people are taking steroids for their arthritis, and that already helps them to kind of balloon up. And if you are having a lot of salt intake too, that helps you to keep fluids in your body, and that's going to help. That'll make you retain fluids, and that you do not want, because that adds extra weight to carry around on the joints. And reducing alcohol when taking any of these medications, but particularly if taking pain medicines, narcotics, or immunosuppressive medications, is very, very, very important. And the supplements, talk to your physician, but here are some supplements that are likely or possibly beneficial, such as omega-3. Omega-3 supplements are beneficial for different conditions, including rheumatoid arthritis. And I'm not going to go into the dosages here. Your doctor would have to let you know whether he or she thought you should take them and in what quantities, because that's, the dosing can be very different. And there's also something called collagen type 2, and it may improve stiffness, pain, and physical function in osteoarthritis at certain doses as well. And some people, they talk about vitamins that might help, like vitamin B12 and vitamin C, different minerals, herbs, or other botanicals like green tea extract, certain amino acids and enzymes. But these you just don't want to play around with without making sure that you, as the captain of your team, talk to your healthcare professionals, so that because they will know what kind of interaction it will have with whatever condition you have besides the arthritis, as well as the medications that you take. And are there any supplements backed by scientific evidence? Yes. Glucosamine, chondroitin, omega-3s, and collagen type 2 all have some scientific evidence that say that they help. So definitely is an idea to bring it up with your doctor and ask if the doctor thinks it would help you too. Okay, and you might hear about some alternative treatments. If you want to try some home remedies, some might work, but ask your doctor what would be most helpful for you. Aromatherapy for arthritis relief, magnets, and copper have not been found to ease rheumatoid arthritis symptoms. And alternative treatments, some of them may give you a little bit of relief or not be harmful, but still, don't let somebody tell you that one of these alternative treatments is going to cure your arthritis. It will not. There is no cure for arthritis. And there are people out there that prey on people in pain. People are often targeted. And unproven arthritis remedies can be easy to fall for, because your symptoms of arthritis, they tend to come and go, at least for some of you. And you may think that the remedy is helping, and it's just that the normal ebb and flow of your arthritis symptoms. And you may see claims that so-called treatments with herbs, oils, chemicals, special diets, radiation, and other products cured arthritis, but it's not true. And individual testimonials do not guarantee that a product is effective. People spend a lot of money on things that they have no scientific evidence. And You just don't want to, number one, get false hope, and number two, spend money on things that aren't really going to help you. So before you try something new, you know what I'm going to say? Consult your physician. And stay vigilant. People around you don't know what it's like to live with arthritis. Share your experience to help them understand what you're feeling. Share what you learned from your doctor with your family, and ask friends for specific support. And you might even be able to ask your workplace for special accommodations, like a special office chair, maybe a voice recognition software, pens and pencils with a bigger grip, and work with your doctor to develop a treatment plan that works for you and stick to it. From exercising regularly to eating properly to getting enough sleep at night, all these can contribute to your energy level, mood, and concentration, which can affect your social interactions with others. The presence of coping with arthritis can increase the pressure of coping with arthritis, can increase your stress and anxiety. This in turn can worsen the symptoms of a chronic disease and contribute to many other problems. Make healthy lifestyle changes to reduce stress. Get active. Practice deep breathing. Seek counseling. And talk with your doctor about these and other medications, antidepressants, anti-anxiety drugs. They can be very helpful too if you and your doctor talk about it and make a plan. And they're often used in conjunction with counseling. But don't let arthritis keep you from going out and doing the things that you always want to do. Whether you want to shop, want to eat out with your friends, or go to a ball game, you can do it. You just might need to tweak your plans a little bit to make it happen. Plan ahead and be clear and upfront with your friends and family about what you can do. And maybe start later in the morning. Maybe first thing in the morning is not good for you. You need a little time for your stiff joints to loosen up. That's okay. Get an aisle seat. That way you don't feel like you're bothering anybody and you can get up and move. Especially, on a plane, you need to get up and walk in the aisle, or you will be stiff when that plane lands and it's tough to get going. And carry groceries carefully. Have them put a small amount in a bag. And maybe you need to make a few more trips a week rather than one big trip to the grocery store. And make sure you visit your healthcare provider regularly and create a plan to manage your disease. Don't skip your appointments, and make sure that you're going to someone who's listening to you, because your arthritis can change over time. And some of you may have already experienced that. So you need to schedule regular visits to continue to monitor your condition and make adjustments as necessary. And so important to take your medicine, the right dose at the right time. Sometimes people don't like to take their medicines and they forget them, or they don't want to spend the money, or they procrastinate with refills, or they have difficulty in taking multi-medicines, or they just don't like the side effects. You need to talk to your doctor about that, because taking your medicine is very, very important for your comfort and for the quality of your life. And not taking your medicine is risky. You can experience more pain and possibly a progression of your disease, especially with the chronic diseases over time. Pain and inflammation can become even harder to treat after they intensify. Non-steroidal anti-inflammatory drugs and analgesics are used as much for prevention as for treatment, just to keep that pain and inflammation at bay. And if if your doctor wants you to go to rehab, go. An occupational therapist can teach you body mechanics and how to use assistive devices and recommend different treatment options such as braces and splints and orthotics and suggest modifications to your environment. And a physical therapist can help you develop a tailored exercise program. And obviously, there are trusted research sources online, such as the Arthritis Foundation, the American College of Rheumatology, and the Mayo Clinic. And I think in one of your handouts, there's a list of arthritis resources available. And, you know, they are very, very good with great information. And you and your healthcare provider, you're the team, you're the captain. Your healthcare provider can help you with your medication, your emotional well-being, your pain, your mobility, your exercise. Very, very important to have someone you trust and visit them regularly. I am going to ask you all, and I will ask Courtney to come back on, or you know what, maybe I'll do this in a different order. I want to make sure you know your key takeaways, and I think it'd be easier for me to give them to you now than, and then I'll ask you these questions. In summation, we talked about you being the captain of your own team and self-management. We talked about exercise and physical activity. We talked about arthritis' emotional toll, about controlling pain, about a healthy diet, about supplements and alternatives, and about staying informed and advocating for yourself and making sure you discuss with your doctor any of these options that you would like to investigate. I'm going to ask Courtney to come on, and I want to ask all of you, if you have any questions, we can have a few minutes for questions. And what are your top 3 concerns that you have regards to your arthritis? And what are the 3 most important things you have learned from this session?
Thank you so much, Barbara. This is great. So again, yeah, anyone who has a question, feel free to unmute and chime in, or you can type your questions in the chat. I'll get started. I have one question. Do you have any tips for, when you talk about being the leader of your care team, do you have any tips for keeping all that information straight and making sure each person on the team knows the same thing?
Well, I think it's very helpful to have someone go with you to the doctors. I run the joint replacement program at Lowell General, and one of the things I always recommend is that they have a coach, and that coach comes to the joint class before surgery, that coach is there when the discharge instructions are given, and they attend a physical therapy session, because it's very, very helpful to have someone else hear everything firsthand. You know, you can take notes too when you're getting the information, but to have somebody else be there with you and say, you're not doing that exercise right, you know, because they saw how it was supposed to be done, can be crucial to your well-being.
Thank you. One question came in. Someone's looking for some possible exercises for osteoarthritis in your fingers.
Wow, well, that's a good question. And I would actually advise that you go see a physical therapist or an occupational therapist. And, you know, and if you've been to your doctor and you've been diagnosed with this, they could give you a referral and you could get a nice exercise program for your fingers.
Great. In the beginning, you mentioned some of the vignettes, the examples. You mentioned so sort of joining social media groups. So I'm wondering if I didn't see that listed on the brochure or the handouts. Do you have any recommendations for how to find those groups?
I don't know if any of you are on Facebook, but I know when my husband had his knee replaced, there is a knee replacement Facebook page. If you search, now remember, it's not generally monitored by a healthcare professional, but there's a lot of stuff that is exchanged and a lot of encouragement, and you kind of realize other people are doing and experiencing what you are at those certain times in recovery. So the same thing with the osteoarthritis, and it can give you ideas about what questions you want to ask. When somebody says something has helped them and you talk to your doctor, hey, you think this would help me too? Education is key to everything, and don't ever be afraid to ask those questions and take control of you. You know you better than anyone else will ever know you.
Mhm. So here's a question related. You mentioned PT and OT. So this person went to an orthopedic hand specialist who downplayed PT, but they asked for a PT referral anyway, and they're still looking. So maybe you could just talk about the difference between those two and what each will provide.
Sure. Well, I'm sorry that one kind of downplayed the other. They are both experts in what they do. The physical therapist they help with mobility and strength training in your joints and your muscles. An occupational therapist is very special because they observe what you can do and they help you to do it better. For instance, if you have your hip replaced and you can't bend over and put on your socks, they're going to teach you how to use a tool called a sock putter runner. Or, they're going to give you a reach tool to make sure that you're not bending over to pick something up. They help you perform your activities better, whether it's getting dressed or they're very practical, a very practical profession. And the physical therapist, they're a practical profession too, but they help you to gain strength after your surgeries or when you have arthritis. They're experts in the conditions of the body.
Thank you.
You're welcome.
Does anyone else have any questions to add? You're welcome to unmute also if you'd rather. If not, I had one question that just left my head. What was it? Oh, yeah. So I think we advertised this session as, for people with arthritis and those who love them. I'm wondering if you could talk a little bit about what would be helpful for your loved ones. If you're not the person with arthritis, have you ever seen anyone provide care that was especially unique or give a great tip for caretakers?
Well, I think sometimes, as the caretaker or the person living with someone with arthritis, you just need to be patient and, sometimes anticipate what the needs could be, but it's so important for the person with arthritis to be honest. My husband, when he was getting ready to have his knee done, I would know when he was more uncomfortable. And, but he didn't like me to keep asking him. So sometimes you just, you need to know that. And I just needed to stop asking him how he was feeling. Okay. I already knew, or I wouldn't have kept asking him. So sometimes it's those kind of things, but the person with the arthritis needs to be able to be honest that they're having a good day today, they're having a bad day today. My husband before he had his knee replaced. I mean, he had a hard time walking up the hill in the backyard. And I always teach when I'm doing the joint class that doesn't seem to make sense to people. They just think, why can't he just walk up the hill? Well, he really couldn't walk up the hill. And people with that type of arthritis, it really is disabling. And that's why you need to get into that self-management and have a plan with your doctor. What are you going to do? What's your goal for your quality of life? And it's so good to have that person who loves you, who is your coach and has an understanding too what the doctor says and what the plan's going to be.
Great. Thank you so much. I think if we don't have any more questions, this is a good time to end, but I wanted to say thank you again to Barbara for a great presentation, for a lot of information. And I hope everyone got the handouts. If you didn't, feel free to email me, Courtney, and I will pass them along. There's a lot of information in there and some good links if you need more. So thank you so much, Barbara.
Well, thank you all for having me. It was a pleasure. And I hope that there's something that you can take away that really be practical for you.
Definitely. Everybody have a great night.
Bye-bye.
Bye.